Hello, welcome back to another episode of Ask the Doctor with Dr. Jeffrey Sherman. As of June 4th, the CDC reports that there are 1.8 million cases of COVID-19 and there have been 107,000 deaths in the United States. Today, we have an important episode about returning to work and returning to the office because some states are lifting some restrictions. So it's important to know how to safely and effectively go back to work during the COVID era. Here we have Dr. Sherman, who has returned to his office, and he is here to tell us about what we should do when going back to work. Nice to see you, Dr. Jeffrey Sherman.
Nice to see you too. Thanks for having me back.
Yep. So we did mentioned this a while ago, but it's very important to bring it up again, how essentially what's very important about coming back to work is having all the precautions, such as masks is the biggest one. I do have some mask samples with me. The typical surgical mask. Got this little fancier N95 mask. And then of course you have...
Yeah, that's a good one, that N95.
And then you have the beefy standard one that you see doctors use, I believe.
Right. I also use, there's an antibacterial one here. It's kind of a larger one, that looks like that. It kind of covers a little bit more around the side of the face. So I got a few of these for the office. And it's got some good sealing on the side, and it gets below the chin a little bit. And it's an antibacterial material, or there's some antibacterial part to it, so that's good. This is a good one to have too. So you got these options as well. This isn't it's soft. It's not so uncomfortable. Sometimes it can dig into your cheeks a little bit. So if you're back to work and need to wear a mask for many hours in a row, comfort's an important thing.
Yeah, that is a very good point, because part of the reason that some people don't wear masks is because they're uncomfortable, which can pose a danger even if you have to get rid of it for like 15 minutes at a time. There's a little risk to that. And speaking of risk, there's, of course, if you don't do some kind of hand washing and disinfecting, then a mask will help but won't do everything. So I think it's good that some people, especially if you have a smartphone, which I think most people do, is to have some kind of antiviral or antibacterial disinfectant wipes.
Yeah. So you have the wipes. So the things you're touching all the time. Your phone, you got to wipe down your phone a lot with the alcohol wipe and stuff like that. When you're at work, you're going to be touching different things. You want to wipe down the phone. You want to wipe down your surfaces in the desk nearby once a day to clean that off. And you want to just wash your hands multiple times. In a medical office, that's easy to do. There are sinks everywhere. So you want to make sure you wash your hands, certainly in between patients, and then just multiple random other times during the day as well. Plus, when you're not near a sink, I happen to have several bottles of the the compounded hand sanitizer, 70%. I keep it in the pocket. I keep it at my desk. So even in between hand washings, you do a little bit of this and you get real good around there. So that's the key, is to keep things clean like that and keep the mouth covered. You're doing about 80% of the work right there.
I'm curious. You said compounded for the hand sanitizer. Is that something special, or is that just because it's small?
Well, you can buy the hand sanitizer at the store or online, but you can also ask a compounding pharmacy. And I asked my friends out in Pasadena at Great Earth Pharmacy, and they prepare it on site. So they'll have alcohol and they'll mix it and make a big vat of it, and they put it in these little bottles and send it to me. So it's like a homemade concoction, and it's not a big company that's sending you the stuff from the store. They make it. It's like they're in their little lab. They're making it. As long as it's 70% alcohol, then that's what they call compounding. Is they make it on site and send it to you, as opposed to you buying it at the store like Purell or some other brand,
Yeah.
which the markup is tremendous. If you can get it at a compounding pharmacy, believe it or not, you'll be getting a lot less less expensive.
That's really cool. It's a homemade hand
Right.
sanitizer.
Right.
But does like
While you're compounding pharmacy, make sure you see the word compounding,
right?
and
Yeah.
they
How
will
would you find
prepare
that?
the sanitizer for you.
How would you find a compounding pharmacy? Because I imagine it's not any kind of pharmacy.
Right. Well, your big pharmacies, CVS, Rite Aid, Walgreens, not compounding. Pharmaca,
Oh,
some of those bigger names, not compounding. It's the mom and pop pharmacies. You kind of just got to do
okay.
a search, a Google compounding pharmacy near me, and oftentimes the word compounding is in the title of the pharmacy, so it'll pop up because they want you to know they're compounding, so they can do things like this, or they can make, you
That's
know, other kinds of medications from scratch, let's say, as opposed to just getting it from the big manufacturers, from the big companies. They can do their things on site. That's what
cool.
compounding.
I mean, do they do other compounding related things other than?
Yeah, they make lower doses of vancomycin. They make different doses of creams and things that we would use off label or even on label. They can make a diltiazem cream. They take it basically a solid pill and can make ointments with it and mush it around.
Whoa. Okay.
They make liquids. They make various doses of other things that aren't manufacturally made, sort of have a niche type of role in medicine. So
It
when you
almost
return to work, you want to make sure you have all those options available to you.
it almost reminds me of actually apothecaries from
Right.
way back
That's kind
before
of the old-fashioned
medicine
way of doing it.
standardized. Yeah, it is. Just you mix it in the back and then you sell it, but it's actually like good. Um, let's see. So I imagine that in order to run a compounding pharmacy, you need to have like a lot of some kind of credentials. I mean,
Yeah, I mean, pharmacy school. They know the mixes and the matches.
okay.
So you learn that in pharmacy school. But when you go to if you're a pharmacist at a big chain, you're not going to really put those into use or practice. But you'll still remember what you learned in pharmacy school to make, compounds, to make alternate doses and alternate formulations of certain medications. And it's math, it's chemistry, it's a little bit of it's like you're being a cook. You got 2
Yeah, it is
teaspoons
like
of
being a
this,
cook.
a dash of that, and a little bit of that, and you mix it up, and before you know it, you got a new form of the medication. So it's
Nice.
it's an art in a way.
Yeah, it is just like a cooking's an art. Let's see.
Yeah.
So I'm gonna bring up this. I have a face shield, which is sort of like a mask, but it's more in front of you. And I was wondering if this is a suitable substitute for a mask, or if it really should just be like an add-on.
I think it's an add-on for a mask. With now that particular shield has some side to it. The shields in the front are good. What you want to do, though, the shields mainly protect your eyes, and but shields generally are in conjunction or in addition to masks. You wear the mask for the nose and mouth, the shield for the eyes, and between that barrier, you're pretty well covered. Still, some droplets can find their way around the shield, perhaps, but not as good as a mask, but just directly up against your shield's better to protect you. As you know, the mask protects the other people, but between the two, you're really protecting everybody.
Okay, so if a face shield is useful for somebody who's really concerned about them catching the virus.
Yeah.
Yes.
Primarily for healthcare workers.
Yeah.
In on the front lines, or
Yeah,
if I'm doing a
high-risk
procedure
environments.
and there's an endoscopy and a patient's kind of spewing stuff out, you may consider wearing a shield. Or if you're doing a procedure in the ICU, you want to wear a shield where there's some blood. You're poking the skin or passing central lines. You would wear a shield there, because things can splatter out. So you want to be careful about that. But in terms of walking, taking a leisurely walk on the street, I mean, it may not be necessary. I mean, it's more for a healthcare setting,
Okay.
an office setting, an ER setting, a procedure center setting.
All right, so it's basically an add-on for most people, but for specific high-risk workers, it's
Right.
quite useful.
Right.
And I guess what's similar to the face mask is actually just goggles. I imagine they do a lot that the face mask does, but these don't protect your cheeks, I guess, from impact. But
no, but you're not going to catch. You're not going to. A droplet on your cheek doesn't do anything. You can't absorb the virus through your skin. Of course, you want to wash your face and get rid of it, but goggles will protect the eyes where viruses and the droplets can get to around the side. So goggles are the same thing. You want to protect your eyes. Goggles do that just very well, just like a shield does.
That's good. We have a question from the audience. Should we wear gloves in public?
The answer is generally not. The key is you're going to touch things on the gloves. You're going to touch surface A. You're wearing gloves, so I'm just wearing gloves. I'm going to touch surface A, surface B, and before you know, you're touching a lot of different things. And inadvertently, you go ahead and touch your face or you touch something else. So the key is to wear the gloves, do what you got to do, take them off right away, and wash your hands. Don't start wearing gloves all over the place because you're spreading things from place to place with gloves. No better than your own hands, which you can just wash and quickly sanitize with sanitizer right away. Plus, so the gloves are not much more of a protectant. If you're not going to be near a sink or sanitizer, you can maybe think about it like if you're going to go get gas or mail a letter or some of those metallic surfaces that you need, that you want to have a barrier from, that's fine. But there's no substitute. You can touch those surfaces. Don't touch your face. Wash your hands, and you really don't need the gloves. You're just transferring things the same way you would with your hands. The gloves are not exactly the best way. I still see patients doing it or people doing it. Fine, but the key is to wash hands and not touch face.
Right. I think that's
gloves are not.
Yeah. That is the thing with gloves is that they can be useful in the right hands. No pun intended. But
yeah.
But yeah, see, like you said, the problem I think is that people get a false sense of security with wearing gloves, and so like they think it protects more than they really do. Because really, all a glove is a layer that you can peel off of your hands. And what I mean by that is that it's like it's basically just a preemptive hand wash.
Right.
It's a preemptive hand wash. You put it on before your hand gets dirty, and then you can take it off, and it's like your hands get washed. But you have to remember that while the glove is on.
But your hands are still dirty when you're wearing them, so you got to be aware of that.
Yes.
Because you're wearing gloves doesn't mean you can just go touching everything and feel great about it. You're still spreading things. You got to take those gloves off, wash your hands. So keep doing so it doesn't add anything. So if it's not adding anything, use your real hands and be aware of it, and then wash them because people take their gloves off and sometimes, I wore gloves, so I'm good. No, I mean, you got to keep doing everything. So if you're going to need to be washing everything with gloves, you might as well just keep your hands as is, be aware of it, and wash them well after you're done with whatever you're doing.
Let's see. We have a question from the audience about should we get standalone air purifiers for office spaces?
Yes, that's a good question. When you have, and that's what I was talking about. So you're coming back to work, you have multiple doctors in the office at the same time, or maybe not multiple doctors, but several patients. We're doing the social distancing in the waiting room, but what we want to do is make sure that patients who come after and sit in nearby spaces don't get exposed. So there's an air purifier, should be in the corner of the room, purifying things. And the key thing on this is you need to buy the air purifier that is good for viruses. There's the ones that are good for allergens and pollens and dust. That's all well and good, but you need even a higher end purifier for viruses that traps 0.003 microns or smaller to clear the virus particles that may be in the air.
0.003 microns.
3. You need as small as 0.003. 3 is the number, okay? I don't know how many zeros. I think there's 2 or 3 zeros, then 3. 0.03 microns, that's the size that'll trap a virus. If it traps anything bigger than that, the virus will slip through. So you need the 0.03, and that'll trap the virus and clean the air appropriately. In addition, that's for the That's for the waiting room and common rooms. What you might want to think about when heading back to the office is talk to your building, and I've done this, and they're going to look into it. And that would be to establish similar filters in the air duct system above.
The air
That way,
duct system.
other floors and the air is recirculated throughout the building. So what happens I'm on the 5th floor. What happens on the 6th floor can come into me. But if you get this special filter in the air duct system, those particles get trapped and will not be circulated in my floor from a floor above me, for example. So you want to not only purify the local air, but purify the common air, or the the air that's circulated through the building.
Are there any easy names that people can see when they want to buy an air purifier? Like, I know that HEPA filters exist. I don't know the details of them, but is there an easy name people can look for?
IQ Air is a good company that makes a lot of air filter products. IQ Air. There's Winter WINTER. Winter makes some good but HEPA is good, but you need that. But you got to do the fine print and do the 0.03 microns.
Okay.
Because they'll give you that statistics in there, and if it's not that small, you're not trapping viruses. So you want to get that. They'll advertise the pollens and the dust and the mold.
Right. Those are much bigger.
And they'll get trapped, but the virus will slide through filters that trap those. You got to get those real tiny filters. So you see the HEPA, but you go IQ Air, Winter, and some other reputable names. But Winter and IQ Air are the ones I've been looking into.
I find it very interesting about the air duct system. When you talk
about bring patients to your office during the day. Those are some of the precautions you want to take when you're coming back to the office, coming back to work here in the medical building.
Right. I find it very interesting how the air duct system could actually, that has to be paid attention to, because I think in some buildings, the air can probably connect between rooms and large parts of the building. And so we wouldn't want viruses going through the entire building and infecting everybody.
Right. It recirculates. So a virus on the 12th floor gets into the system and goes through, and who knows, before it can die out or do whatever it's going to do, it can be re-injected into the 10th floor and land on somebody there. So if you have a filter in the ceiling, it'll trap that. So you want to make sure you can get that done.
That's very important.
I realize it's a little bit out there, but it can happen, and you want to be careful. You want to be thorough.
Mm-hmm. Yeah, I imagine, does Cedars have filtered vent systems?
The hospital is a unique design. They have an interstitial, what they call an interstitial system. They have so to answer your question, that's not a problem over there. Okay. They have the hospital floor, and then there's an empty gap of purifiers. Then the next floor,
purifiers.
Then an empty gap. So there's a floor gap. So that interstitial space is where all the things are purified for the floor it corresponds to. So Cedars, it was built that way, knowing that it was each floor is its own individual unit, and it doesn't share due to this interstitial space that has its own filtration system.
That's actually
the
really
office
cool.
building here isn't like that. They have it's floor.
It's an office building, so I mean they might want to add something to the vent systems if they are connected in the office.
Yeah, buildings. They have to have purify the air the best.
We have a question from the chat about mask washing. With a mask, shouldn't they wash it daily if they don't have access to a new mask? For some reason, people don't think about touching the front part of the mask when removing it either. Or is it possible that the virus can cling to the mask?
The virus can cling to the outside of the mask temporarily and then fall off or die pretty quickly. It's not the most ideal spot for a virus, but the droplets, once it's on the outside of the mask, you're okay. To answer the question, though, you should wash the masks daily.
Okay. Like a mask like this, if you have one that's firm.
Well, that's a different story. That doesn't really get washed. That gets set aside for about 2 days, ideally. I know when there was a shortage of those, they were using all the time. We really didn't have much choice. But ideally, a mask like that gets set aside in a paper bag, not in a Ziploc bag, but in a paper bag in an isolated area and just left alone for 2 days. Then, you can alcohol the straps, you can alcohol the rim of the mask, and then reuse it. Okay. A cloth mask, such as the one I showed you earlier, should be worn once a day and then washed daily. The disposable masks, the blue one that you had, it's once a day and disposed of. Yeah.
Yeah.
You can wash those, by the way, and
Okay.
reuse them. They do fall apart after a wash or two, but they still are effective after a wash, and they shrink a little bit. I know from experience. I've washed those because at first it was hard to come by some masks, and those can be washed and used, but they do fall apart after about two washes, and then they don't work anymore. These N95s don't need to be washed; they just need to be set aside, and then the cloth masks do need to be washed every day. Not the end of the world if you don't, because viruses will not last on the surface of this very long. But just it's general good practice to wash these daily. I bought several of these, knowing you have to wash them daily. So I bought about 14. So I'll wear a week's worth, wash, have the new ones wash, and keep going. So kind of like under a t-shirt or something, you wear them one day and wash it.
Yeah, and by wash you mean, of course, laundry washing.
Yeah, you can do it in the laundry machine, warm water. You can do it by hand if you want. Warm water, scrub with soap, and let it dry. But laundry's the best way because you're going to get it all. You're going to get it all that way.
Yeah.
And as I was saying, those disposable masks can withstand a couple of cycles in the laundry machine, but you'll see they start to wear away, and once you see that, you'll have to throw them away.
So when you mentioned these masks and how they should be isolated, you said how they should not be put in Ziploc bags. Right. I guess why is that?
It gets a little bit moist in the Ziploc bag. It takes a little bit longer for the virus to really fade away. So if you by the washing machine for 2 days, you'll retrieve it in a couple of days. Go. Just clean maybe the swab and the rubber bands with an alcohol swab, and that's the way. But the Ziploc, it'll work. Ziploc, you just have to wait a little bit extra, and it's a little bit moist, and the virus can.
Do you mind repeating a little bit of what you said in the past minute, because you were kind of cutting out a bit from connection errors? Something about cotton swabs.
The Ziploc bag will promote, or the Ziploc bag is an environment that the virus doesn't fade or decompose as rapidly as it can. So a dry brown bag, like you used to bring your lunch to school in the brown paper bag, in 48 hours, 36 to 48 hours, it'll work.
All right, so that's very important. Yeah, when I would look at one of these things in a Ziploc bag, I would think about how the moisture doesn't escape, but I kind of just did it anyway. But yeah, brown paper bags.
And even if you don't Ziploc, the plastic is still an environment. So even an open Ziploc bag takes longer, but a brown paper bag open to the dry air near your washing machine or off to the corner of your laundry area, for example, that's a pretty good spot to keep the N95s until it's needed again.
So now that you're in a doctor's office, and so I imagine there are other doctors in their offices. So now people can essentially schedule appointments.
Yeah, we have an open office schedule. We stagger them a little bit more than we used to. It's a little bit more spread out. But believe it or not, patients have been coming in. We have sanitizer available for the patients in the waiting room. I mentioned the air filter. You brought that up. Good question. We have one patient at a time at the reception desk window, and the seating has been spread out. We bring patients in one way and out the other. It's kind of a one-way street. Everybody's going the same direction. And in between patients, we Lysol and spray down the exam table, of course, once they have left, and I wipe down the chairs in my office where the patients were sitting across from me. Plus, I keep those chairs, 6, 8 feet away now, as opposed to right up against my desks. So it's a little bit different that way.
All right, so that's really good, like improvements. So now that now that doctors' offices are in session, I guess the how should, I guess, people prepare for the doctor's visit? I mean, there's obviously how you would prepare during a normal visit, but what are the extra things that people should do?
Well, you obviously have to bring your mask, bring some notes, be ready to answer questions. The way, we don't want to be face to face for too long, so you got to make the time count. You got to have your story ready to go. Kind of like what we talked about for telemedicine too. You want to have your story ready to go. You want to have any important paperwork or previous tests or labs ready to go to hand over, and and I put a little and to hand it, drop it on the desk, and I'll have it here. We don't do touch contact. You want to have those things ready to go. You want to have your story ready, and just and know your schedule. If we have to schedule things, we want to kind of work that out while you're here, so you don't have to come back and or revisit the issue, and just kind of be prepared for that, and make the time count, because we're going to move fast, because time is a thing when you talk about exposure. So we want to minimize the time.
Okay. So yeah, people should be prepared to be very efficient with their meeting and be prepared, I guess, with notes and knowledge and history of their symptoms, because very important to remember, other medical problems do not stop existing just because there's a pandemic going on.
Right. Yeah. I mean, I've had, it's been a few days since I've been back here in the office, and I've already, what I thought may be a little bit of a slow ramp up has a little bit more rapid than I originally thought, and I've scheduled several procedures already, and so we're already sort of booked through next week and into the following. So people need to get their procedures done, because they've been off for 2-3 months and are overdue now. So we got to get back to work.
I think a very good thing to end off with is maybe a little demonstration in the proper way to hand wash, because I know that some people focus too much on maybe the time that they're hand washing, but maybe not the technique, because you have to get between. I think you have to get between your fingers and back.
Right. So up here, I'll do it here without the benefit of the soap and water, but pretend there's soap and water on my hand. You get plenty of soap. Okay. You want to start to do the around like this, but then the key thing is the back of the hand. So you want to kind of do between the fingers, scrubbing the back of your hand with the front of your other hand, and you're doing this back and forth motion for a little bit. Then you switch and do it the other way. You have the back and forth motion with your hands and fingers going through here, okay? The key is the fingertips also. So your next move is going to be getting the fingertips like this, okay? And then you're going to switch ways and get in the other side. So you're going like this, okay? When you're doing this and that, you're getting your fingers, but your thumbs are not so good. So then you want to go and do a thumb wash. And then the other side with the other thumb, and do the thumb wash with this. So so once you've gotten, you're singing, I think it's 2 minutes altogether. You're doing this, you're switching and doing this, you're going here, you got a thumb, and you got a thumb. Then separate rinse with one side, separate rinse with the other. Have the towel nearby, pick it up, turn off the faucet holding the towel, then dry the hands that way. You don't want to touch the faucet, and because you just cleaned the faucet. Who knows? It's probably okay, but the clean towel, turn the water off, dry, and then you're good. So that's the hand washing protocol that I've been doing several. It takes a few minutes, but you'll be glad you did it. and you stay healthy.
Yeah, yeah, yeah. Oh, that's so cool, and it's it's just because of the geometry of our hands, I guess. Because yeah, you can't really just do this. You have to get everywhere.
Yeah, the back of your hand. Look at how that's a big surface. You got to clean. You got to scrub that. That's big time because that's gonna hit things, and you're gonna pass things. You think you wash your hands, but the back of your hand is still. So that's the key is the that between the fingers, and then you're gonna get all the corners and stuff that way. Right? You do this, good, okay. No, but there's a lot more you haven't covered yet.
All right. Right before we end it off, I would like to just briefly answer this question in the chat that asked, is homemade hand sanitizer from a local distillery still really effective? I believe 70% alcohol, it works.
Right. That's kind of like what I was talking about with the compounding. I mean, if you can get 70%, you can. That's the magic number. So 70%, a homemade distillery will make you 70%. That's good. Even 68, 69, I mean, you're okay. Anything below that, let's not do it.
Okay.
But if you can get it made at a homemade distillery at 70%, you're good. Now you got to use it right. It's kind of like doing the hands. The hand sanitizer is the same way. You want to get the back of your hands too. So get it all around, all around.
All right. And that concludes this episode of Ask the Doctor with Dr. Jeffrey Sherman. Now you are prepared to enter a doctor's office or enter your workplace and have the proper knowledge to defend yourself against COVID and your coworkers. And maybe you can even tell superiors to add filters into air systems and bring air purifiers with 0.03
as small as 0.003 microns to trap the virus.
All right. Thank you all for being here. See you next week at Thursday, 3 p.m. And as always, stay safe, wash your hands, wear a mask, and see you next week.
Thank you.